I'm ready to help someone on the worst day of their life.
Oh. It's the ambulance here, mate.
As soon as we arrive, they just know they're in safe hands and that we're going to do everything we can to help them.
Does that feel better? Yeah?
I wouldn't have guessed you were 104.
I genuinely think laughter is the best medicine.
Let's go. Teddy wants to go. You're very brave.
To know that you bring someone that's very unwell to hospital and they get better. It's one of the best feelings in the world.
I promise I'll look after you.
Second to God, these people.
Let's get you in the ambulance, eh?
I feel really proud to wear this uniform and I feel really proud to be a paramedic.
On this episode of Paramedics...
It's killing me.
Big breath, sweetheart. Good work.
Can Aaron and Laura help a terrified patient with a failing heart?
You're okay, I've got you.
With these patients, literally seconds can make a difference.
Did they tell you that chest pain could be a heart attack and you can die?
Dan confronts a difficult patient.
He's off, is he? He's going for a run.
This patient needs to go to hospital. Unfortunately, he's not having a bar of it.
I've been at hospital for a while and I'm not going.
Now, Nelly, you probably get asked this all the time, but what's the secret to getting to nearly 105?
And will Chris and Sam discover the secret to a very long life?
Is it brandy?
No.
There is no way that this woman is 104 years old. I need to know the secret.
SA Ambulance Service.
At the South Australian Emergency Operations Centre, hundreds of residents call in every day, pleading for help.
How many minutes apart are the contractions?
Listen carefully, this could be a very dangerous situation.
SA Ambulance Service, tell me exactly what happened.
This time, it's a woman on her own, dealing with frightening symptoms.
I've got chest pain. I feel like an escalates decided to crush me. I've got one side of my face that feels like I've just been to the dentist. One side of my face I can't feel.
Okay, I've organised help for you.
So we're going to a 55-year-old female. She's got chest pains, crushing feeling.
Oh.
So she's got a history of cardiomyopathy as well. So that's obviously a bit of a concern as well.
This case has Aaron and Laura on high alert.
Cardiomyopathy could lead to heart failure, and then it's a bit of a vicious cycle because then you're not getting oxygen to your heart and it causes more chest pain.
And you'd feel like you couldn't breathe. I think the most concerning
Is the crushing chest
is
pain.
the crushing chest pain, yeah.
You hear crushing chest pain and it sounds bad. That's the typical telltale sign of someone having a heart attack. With these patients, literally seconds can make a difference.
Hello, ambulance. Is it Lena? My name's Aaron, this is Laura. So tell me a bit about your symptoms today. What's happened?
I woke up after having a little nana nap and I vomited in my sleep.
Is that something that might happen regularly?
I have been vomiting lately, don't know why.
Yep.
And I have had a 14-day stint in hospital because I had lung infection.
Yep. Is that from your heart as well?
Well, I've got a heart that doesn't work. I've got 25% ejection fraction.
Okay.
An idea what kind of a heart I got?
Yeah.
Lena suffers from a condition called cardiomyopathy, which severely reduces her heart's ability to pump blood around her body. The disease puts her at high risk of heart failure.
So you've got a couple things going on. The one thing I just want to cover off quickly for you, do you have any chest pain at the moment?
Yes, this feels all crushed.
Sure. And can you point exactly where?
This area.
Okay.
I'm worried that with Lena's level of heart failure, her body isn't getting as much oxygen as it needs. She's sitting there quite breathless. And ultimately, I'm worried her heart is actually going to give up.
We're off to an elderly gentleman to support a crew who are querying whether we need to offer him some sedation.
Across town, intensive care paramedic Dan is also starting his shift with the lights and sirens call out. The man in his 70s is complaining of chest pain, but he's refusing treatment and behaving erratically.
This is a difficult one. It's an elderly gentleman clearly having an acute behavioural crisis of some kind. The trick here is that in the elderly, there's a lot of medical causes that we have to consider as well.
The man caught the attention of police while out driving. They followed him home and called an ambulance when he became distressed.
We don't really want to have to give sedating medication to an elderly person. It's a last resort, but we'll do it if we need to.
Going to a sedation job with police, the likely element of danger does sharpen your focus somewhat. Yes, the patient might be in his 70s, but make no mistake, it can still be extremely dangerous scenes where people are aggressive and violent.
I assume this is the place.
You don't want to rush into a job like this. Firstly, I would love to be able to de-escalate the situation. Try to talk the person around.
Hello. How are you?
Good, how are you?
Yeah, good, thanks.
Can I have a chat to you first?
Yeah, sure. Yeah, come on out.
So what we've essentially got is a 79-year-old male. This gent does have a history of some dementia, doesn't like doctors, doesn't like hospitals.
So,
Here he is.
Oh, hello, boss. How are you, mate?
All right, thank you.
I'm Daniel. What's your name?
Brian.
Heard you had a bit of a heart problem.
No, I had a run problem, run too fast.
You're running too fast. Jeez. What's the doggy's name?
Missy,
Missy might need to go for a run.
we'll go for a run. I'll go for a run.
Oh, I reckon you'd probably outdo me, to be honest.
Probably will.
Oh, hello. It's fighting words.
I finally get to see Brian, and thankfully, he seems like a far more agreeable chap than what I feared when we first got the job.
I do it all the time.
He seems a larger-than-life character, so I think we're going to have an interesting time here.
I heard you had some pain in the chest.
Yeah, it'll go away. But the head's taken over.
Has it? What's wrong with your head?
A headache.
You got a headache as well?
I have a headache before this started.
Okay.
Our patient has concerning symptoms. Chest pain could easily be a heart attack, and in his 70s, a severe headache could easily be one of the signs of a stroke.
If I run, I might blow it off.
Well, you'll probably collapse, I would say.
It will not collapse.
This patient needs to go to hospital. Unfortunately, the big issue now is he's not compliant and not having a bar of it.
I've been at hospital for a while.
You and I can both agree that this is too high.
And this is just low. You and I might see things differently.
But you and I bet with the best. Unibet.
You win some.
Hey, you ever use those dating apps? What, like the swipe right for like? Yeah, I don't know how they work, but you'd know, wouldn't you?
After both going through a separation, housemates Chris and Sam are getting up to speed on single life.
When I first got divorced, I gave them a crack. I wanted to see what all the kids were talking about. You don't even have to talk to the person or know anything about them, and you just, yes, no. Yeah, rough. Super yes. But I never had anything come out of it. Oh, wow.
I do still believe in true love. Call me a hopeless romantic. I don't think being divorced has changed the way I feel about that. I'm a bit of an old soul.
What about you? No, I think my approach is you just never know when you might meet someone nice when you least expect it. Yeah, 100%.
But Chris and Sam's love lives will have to wait. A job's coming in for a record-breaking patient.
All right, so we are going to a 104-year-old. 104?
Wow. We do not go to people this old very often. She is definitely the oldest person I've ever been to.
She's at a doctor's clinic. She has had a fall. She's presented to the doctor's clinic with facial and leg injuries, and there was some bleeding, but it's been controlled. Poor thing.
In the elderly, a fall can be a really life-changing event. If they break a hip, they end up in hospital, they have so much rehabilitation to do, and a lot of the time they don't return to their normal living afterwards. She's done so well to get to 104, but I'm quite worried that this might be a life-threatening event for her.
So 104-year-old having a fall, obviously you've got to be careful with any sort of head strike. Yeah. Changes to her conscious state.
What's her name?
Nelly. 104-year-old Nelly.
I do love the oldies. My grandparents were a huge part of my life. Having a single mum, my grandpa and my grandma were basically my second parents. Unfortunately, Pa passed away pretty recently, but Nan's still kicking on and we still have a really good relationship.
Down this way. Hello?
Second bay.
Second bay.
Nelly's been kept under close observation at a local doctor's surgery.
Hello, this must be Nelly. Hello, Nelly. I'm Sam and this is Chris.
She's looking pretty good for 104. I would have pegged her as probably 20 years younger, I think, when we first look at her.
Sorry, sir. What was your name?
Robert.
Robert, okay.
Nelly's 80-year-old son, Robert, came to his mum's rescue when she fell at home.
What's happening today, Nelly?
She had a bad fall into the bathroom and cut her knee badly there, and there's several cuts on the side of her face.
Poor thing.
So one can go through to the bone.
Robert is an incredible man. He's 80 years old and he's moved back in with Mum so he can be her primary carer. I can't imagine being 80 years old and moving back in to look after my mum.
How are you feeling at the moment? Pretty sore.
Sore.
Yeah, I can imagine. Now, Nelly, do you remember falling?
No. Do you remember falling, my dear?
Did you black out at all or lose consciousness or anything like that? No?
No,
Okay.
I was in too much pain.
Oh, dear. Where exactly is your pain at the moment?
No, not in the face.
At 104 years old, the fact that she's hit her head makes me quite worried. She could be having a very slow bleed within her brain, and that could be disastrous if it's left untreated.
I'm not sure that you fully understand what the risks are.
Intensive care paramedic Dan is doing his best to negotiate with the non-compliant Brian.
Did they tell you that chest pain could be a heart attack and you can die?
I know I feel okay.
The 79-year-old is showing symptoms of a possible heart attack or stroke, but is refusing to go to hospital.
This is a tough predicament because I need Brian to seek medical attention, but I really don't want to have to sedate him. So I'm left with the Hail Mary of trying to convince him that it's a good idea to come to hospital.
At your age, the risk is very high.
I'm only 21. Maybe I give it a bodgy age.
Yeah, you're not still sneaking into nightclubs, are you?
I had.
Used to grab the night bus.
Yeah, I saw the bus out there. You would have some pretty good memories there.
Lo and behold, Brian is the party bus man. He's the man who drove bus loads of revellers around, and Brian would show them a good old time. He's basically Adelaide royalty, so his character, it's all starting to make sense to me.
He's off, is he? He's going for a run. He's enjoying the attention.
It's now like we're going from the sublime to the ridiculous. Brian's now indicating he's gonna just jog it off. His potential heart attack that I've been talking about, he's just gonna run it out.
It's now up to Dan to make a tough call.
He's not 100% safe. I think we can probably account for that, but I think injecting something into him just to knock him out, just to take him to hospital is a fair stretch. He's off to the bird cage. This is great.
Come on, Butchie. Come on.
I'm getting a little bit frustrated that this job isn't moving forward. But I know that if I push too strongly onto Brian, I reckon he's going to get his back up.
Butchie, come here.
But he's got chest pain. The longer this delays, the worse his outcome will be.
Come on, Butchie.
I feel like I'm really balancing the tightrope now.
Now, do you mind if I listen to your chest? Just big, deep breath for me.
55-year-old Lena suffers from a disease called cardiomyopathy that's causing her heart muscle to fail.
When you walk around and exert, does it get worse?
Oh, yeah.
With the heart no longer pumping effectively, Aaron and Laura are worried dangerous fluid is building up in their patient's lungs.
Fluid on the lungs is 100% life-threatening. It means that you can't get oxygen into your lungs and into the rest of the body. That's extremely bad and can lead to cardiac arrest.
You've got a small wheeze down the basis of your lungs.
A wheeze is a sign that Lena's lungs are now filling up with fluid and she could stop breathing.
Is that blood pressure come back?
Yeah, it was 160 on 115. So a little bit high.
I think because you've got that crushing chest pain and then your history of cardiomyopathy, hospital's definitely the best for you today.
Yeah, I'm not going to argue with you.
Okay, good.
I'm just too unwell. I can't even get up to go to the bathroom, so, you know. Okay, I've got so many things wrong with me and I've got to keep...
Hey.
Sorry, I'm just talking to myself.
No, we're going to look after you, all right?
I really feel for Lena. She's already had 2 weeks in the hospital recently and now we're recommending that she goes again.
You won't let me stop breathing, will you, right?
I won't let you stop breathing, promise.
I can't imagine what it's like to spend so much time in the emergency department for them to get you better, send you home, and then you're right back where you started at square one.
You're managing so good.
I can't breathe properly because my chest hurts.
Lena suddenly looks at me and tells me that she can't breathe. She's scared, and right now my priority is getting Lena calm.
You're doing fantastic. Oxygen's great, your heart rate's great, everything's looking great, all right?
I'll just go around if you want to push.
Yeah.
Laura and I are both worried about her failing heart. She needs to get to hospital as soon as she can.
I'm good to go, Laura. How's your breathing feeling?
Feels like it's gonna explode.
NFL team leads at the half? Celebrate early with Neds. Back in NFL team to win, and if they're up 8+ points at halftime, you win. Available on head-to-head bets on select NFL games this week.
Chances are you're about to lose.
So, Neve, did you have any high school sweethearts?
I
back
did.
at school? Yeah?
I did. I feel like you go to high school, everyone has that one high school sweetheart.
Nee and Carlos are indulging in a bit of reminiscing in a break between jobs.
I went out with guys, heaps in high school. I had boyfriends and all that stuff. But I could, romanticise them, if that makes sense. I feel like I was one of the boys.
Yeah, right.
So that's when I realised, maybe I'm not into guys. And that's when I started exploring the dark side. And I never looked back.
Since coming out during high school,
You do salad and I'll cook the rice.
Nee's found the love of her life, Camilla.
We've been together for almost 4 years now. It's not too bad. We live together with our 2 fur babies.
Look at her. Look at your belly. Who's feeding you all those treats?
But the journey has not always been easy.
In the Asian community, if you're different in any way, you can get isolated. So it was very difficult for me because I wasn't only thinking of myself, but I was thinking of my mum and dad. I didn't want them to be shunned from the community. But I think just for my own happiness, I had to come out, I had to tell my mum and dad, and they were very supportive of it. They've come such a long way.
Now, the pair are planning to get married.
We want to try and combine both of our cultures. So she's Vietnamese, I'm Latina.
The alcohol list is the most important one.
I know you're going to want some gin. I'm really, really excited to just see both of our families and our friends and everyone that's kind of had their own piece in our story just come together and celebrate.
Not bad. Wait, this isn't the one that
No,
you're...
I'm not going to show you my wedding dress.
Then I don't like this one.
It's now back to business for Nee and Carlos as their next job comes in.
So we are going to a priority 2, to our high school.
Yep.
For looks like a 13-year-old.
A schoolboy's had a serious accident on the basketball court.
It says here that he was hanging on the basketball ring, fallen and hit his chin, and fractured wrist.
My initial thought is this kid must have been trying to do some amazing slam dunk and recreate a Michael Jordan moment, and it's just gone completely wrong and he's hurt himself.
He's still on the ground, unable to move due to the pain.
Okay.
I'm thinking maybe he's hit his head. We are 1 minute away.
Every time I get a job with a paediatric or a kid, I get kind of nervous because they're a completely different ball game to an adult. Their bones are still growing. They're more prone to breakages. So given that the bus will ring's about 3 metres high, there's massive concerns that if he falls in a certain way, he could be paralysed.
Is this Jake?
Jake, yeah.
Hi, Jake. So what's happened?
Looking at Jake's arm, he's definitely broken something. It's quite bendy. He almost looks like he's got 2 elbows. It should be straight, and it's not straight at all.
So how'd you do it?
I was trying to move the hoop and then I had slippery hands and so I fell.
Did you black out? Did you hit your head?
Hit my chin and arm.
Just hit your chin and arm? Oh, yeah. I see that. Yeah.
The graze on Jake's chin, it's a clear sign that he has actually hit his head. So I'm quite concerned that he potentially has caused other injuries, not just to his arm, but to his neck, to his spine as well.
How bad's the pain at the moment? Is it small, medium, or a lot?
A lot. It's just,
Where's it hurting, Nelly? Any pain in your head or your neck?
Chris and Sam have been called to a very special patient, 104-year-old Nelly.
We might have a look at the actual sort of wound on her face, I think.
Nelly had a fall at home and badly smashed her face.
Sorry, Nelly. Come and have a look at this, Chris. You can see her bone.
Ooh, yeah, I think the bigger the rough.
Yeah.
My concerns for Nelly are she has hit her head and she is 104 years old. But I'm also worried that if she doesn't get that cut looked at soon, she could get an infection which may lead to sepsis and possibly death.
Robert, I think we'll have to go to the Royal Adelaide with her. It is a bit of a tricky sort of cut on her face.
With a high risk of infection, the 104-year-old needs specialist treatment urgently.
Bit of a spin, there we go. You can have Chris's hand now. Wow, lucky day. Well done. Good work. Perfect. Good work, everyone.
How was that?
Mainly you, Nelly.
Bed's just coming up, Nelly. You're going to be flying in a second.
You won't be playing the pokies this afternoon.
Oh, all right, let's get you to the hospital, hey? It's got to be hard for Robert seeing his mum go off to hospital in an ambulance. He doesn't know how long she's got left. Is this going to be the thing that she struggles to come back from? You can see it on his face that he's really worried about her. Oh, you've done a bit of a number on yourself there, Nelly, you poor thing. All right, should we take you to hospital? Yeah, let's do it, hey?
How are you feeling? You're doing so good.
Aaron and Laura are on their way to hospital with 55-year-old Lena. Her heart's not working properly, causing life-threatening fluid to build up on her lungs.
I went from working 70 hours a week to having a heart failure that came out of left field and everything stopped.
Yeah. I can imagine that would be really hard for you.
Yep.
Now, in terms of your medical history, you've said you had a little
I've got a
defib that's gone off once.
Yeah. I don't want that to happen again.
Lena's internal defibrillator will deliver an electric shock if her heart goes into a dangerous rhythm.
Oh my God, my chest really hurts all of a sudden. I don't know why.
Yeah, you're okay.
Oh,
so
wow.
what I want you
What's
to do is
happening
just
too?
breathe. Your heart rate's just a little bit faster, okay, sweetheart?
I'm not
all
anxious.
right?
What's happening?
Suddenly, Lena's heart begins to race.
Hey, Laura, can you just go on a 2, please?
Why do I feel like I'm going to stop?
You're okay, sweetheart. So I'm going to let you know, Lena, your defib might go off, but I promise you I'll look after you, all right? You're okay, I've got you.
Lena's heart rate is sitting upwards of 180. That's 3 times the normal limit. She's terrified that her internal defib's going to go off. There's nothing I can do to stop that.
Big breath, sweetheart. Good work, good work.
Ultimately, if Lena's heart rate stays in this any longer, this can lead to a cardiac arrest.
Oh, my chest, it's killing me.
Debbie Hubbo's Price Frenzy is on now with crazy deals. With 40% smashed on this HP laptop, that's $1,000 off. And grab a red hot deal on this Falcon 55-inch TV thrown out for $399. Absolutely nuts. JB, you've done it again.
Paul's Plus Protein. High protein, great taste. It's protein made for busy days. Made for on the go. Made for snack time. And made for you time. Paul's Plus Protein. It's protein made for life.
So what I'm going to do, mate, is I'm going to give you some pain relief, okay?
Carlos and Nee have been called to a local high school after 13-year-old Jake fell 3 metres off a basketball hoop.
I'm going to have a feel down your neck, okay? If it's sore, you let me know.
The young student has a suspected broken arm.
Any pain there? No.
He's also at risk of head and spinal injuries.
Down your back? No. Excellent.
Luckily, there seems to be no sign of spinal damage, but Carlos still has concerns for Jake's arm.
Can you wiggle your fingers? Excellent. What we're going to do is we're going to pack this and keep it nice and straight for you. If Jake's blood flow supply to that arm decreases, that means he could potentially lose sensation to his fingers and never be able to use that arm again.
Keeping watch over Jake is his good friend Tate, who was with him when the accident happened.
We weren't trying to dunk, so what happens to bring the ring out, someone normally hangs off it, just we pull their legs very slowly.
Oh, okay.
Right. So his hand just kind of slipped off.
Right, okay, gotcha.
Given what's happened today, I don't think Jake should be offering his services as a human pole again for his mate, because I know if Carlos asked me to do that, I would say absolutely not.
Keep using that whistle, mate. Keep using that whistle. Is that Mum with you? Is that Mum? Yeah.
Also by Jake's side is his worried mum, Carolyn.
So yeah, my recommendation is going to be a trip up to hospital to the women's and kids. It looks like it is fractured. Yeah. All right, mate. Do you want to sit up slowly? I'm going to support this arm for you.
1, 2, 3. Up you go. Nice. Breathe in, breathe in. Breathe. No, out slow. Good boy.
That's it, mate. Doing really, really well. Nice and slow. How's the pain?
10.
Okay. Jake's saying that his pain is 10 out of 10, even with the pain relief that we've given him. So it's quite important to get him to hospital and x-ray that arm and just make sure that we haven't missed anything. If you lose sensation to your hand, it can change your whole life, from holding a pen to never playing sports again. All right, Jake, I'm gonna sit beside you, all right? Which is devastating if it happens to Jake just being 13. I am good to go.
Cool.
All good, mate? You going in for a check?
Come in, dog.
Missy, in or out? In. There you go, Missy.
Dan and the team have just had a breakthrough with their reluctant patient, Brian. The cheeky 79-year-old is still refusing to go to hospital to investigate his chest pain and headache.
Have a seat, mate.
But after much persuasion, he's agreed to let the paramedics check his heart.
How many can you fit in the bus?
I've got 180, I think it is.
180 on the bus?
Double decker.
Brian's famous for driving a party bus around the nightclubs in town.
We always wondered if I'd meet the person who drove that bus one day, so here we are.
We're making a little bit of headway, and I'm hoping my genuine interest in Brian and his life has created a little bit of trust so that he will see me as someone who has his best interests at heart.
What's that noise?
Oh, it's a bit of carry on. It says your heart's going much too fast.
Oh, bullshit.
With Brian still refusing to budge.
There are a few concerning things on here with your heart rate and your blood pressure, which is very high.
Dan ups the stakes in the negotiation.
I mean, I don't finish my shift until 10 o'clock, so I could probably outlast you today. Yeah, I've probably got a good 8.5 hours I could stay in here pestering you. Do you want to put up with me for 8.5 hours, or do you want to put up with the doctor for 1 hour? And then we'll get you home, all right?
The moment he heard that he was going to have to talk to me for the next 8 hours was the breaking point for him.
Fair enough.
And said, nah, I've had enough. I can't do this any longer. Let's go.
On my chariot.
Yeah, jump on there. That way we can stitch up a bit in the way. Oh, imagine that, eh? Here we are.
I can totally see how Brian's losing a sense of his independence. There's an element of, if I go into hospital, am I going to come home? Will they just put me in a nursing home? Will I come back to the pets and the family that make me who I am?
I don't like being locked in one of these, you know.
You feel a bit claustrophobic?
Yes.
Yeah, I'll be with you. It's all right. Okay. We can head off, mate. Thank you.
I feel okay, but am I okay?
Well, look, I hope you're okay.
Yeah, okay.
It's enough for me to make sure you get checked.
At hospital, doctors will assess Brian for both a stroke and a heart attack.
Clearly, we need to make sure that the issues of today are sorted in terms of his chest pain, his headache, the confusion.
I know where I am.
Where are you?
Going to the hospital.
Yeah, that's it.
The next step's going to be the trickier one, to make sure that Brian is safe and well able to go home and function as he was.
All right, legend, we're ready to go in.
And live independently.
Yeah, I've seen that place before.
Big breath, sweetheart. Good work, good work. You're doing so good.
It's killing me.
Intensive care paramedic Aaron is desperately trying to keep Lena calm, while his partner Laura drives lights and sirens to hospital.
Gonna stick some sticky dots on you?
The 55-year-old's failing heart is racing out of control, and she's at risk of going into cardiac arrest.
I'm staying calm, but my chest.
You are doing so well, okay? You are doing so well.
I know Aaron quite well, and so you can tell that although he sounds really calm, he's definitely feeling under the pump and a little bit stressed out.
Big breath. Look, Lena, stop. Look at me, look at my nose. Right here.
Yeah.
What you do? Big breath in. And out. Good work. You're okay. You do it. It's settling. Big breaths.
Thankfully, Lena's heart is finally slowing down to a normal rhythm.
Everything looks good. Your heart's back to normal. All right.
Yeah, I'm starting to get back to normal.
Can I have a quick chat to the RA?
Yeah. Prospect 50 message. If we can stay calm for these patients while they're having these severe medical episodes, then when they're freaking out, we're not going to make things worse. So even though I'm thinking, oh my God, what's going on? This is really scary. We need to have just like a game face. We're just turning into the RA now.
At hospital, Lena's heart will be urgently investigated.
That was hardcore, that one.
You got my heart rate up.
Ultimately, she might need a heart transplant to survive.
I hope that when we get to hospital, they can sort out Lena's heart, exactly what's going on, and make sure nothing like this ever happens again for her, so she can live the rest of her years happy and healthy.
Look familiar?
Yeah.
Stomach pain with cramps is a specific type of pain, so it makes sense to consider specific relief, like Buscopan. Buscopan is an antispasmodic that is specially developed to relax the muscles of your digestive tract to provide rapid relief from stomach pain with cramps. Its two-step action relaxes stomach cramps to relieve the pain, offering targeted relief where cramps occur. The small, easy-to-swallow tablets work fast and are gentle on your stomach. And that's your healthy bite.
I'm waiting to tell my mates all the stories.
Carlos and Nee are taking 13-year-old Jake to hospital for a painful arm injury.
I still think this is a dream, so...
Oh, really? It's probably the green whistle doing its work. It might make you a little bit spacey.
The schoolboy crashed 3 metres to the ground while helping his mates fix a basketball hoop.
Bro, I'm never playing basketball ever again.
Yeah, I think no sports for a while that heals.
Tell my mates, so I'm doing my homework, can't do that.
While Jake won't be shooting hoops anytime soon, there is one sport he's worried about missing out on.
Do you think I can play baseball again?
They're gonna x-ray it and see how bad it is. It might need surgery, it might not.
So I want to go to Major League.
Is that your goal? What position do you play?
Pitcher.
Yeah, right. Wow, got a strong arm on you.
Yeah.
You left or right-handed?
Right.
Ah, of course,
So
it's
I'm
always the one, isn't it?
2 minutes.
2 minutes.
No, I know it's definitely not a dream. The only question I'll have when I get to the hospital is when I'm leaving this place.
Yeah, fair enough.
At hospital, x-rays will determine whether the brave teenager needs surgery to fix that all-important pitching arm.
Use that whistle, use that whistle. Jake's just been a legend this whole time. I'm really hoping there's no significant injury to that arm and he can go back to playing baseball and hit a home run.
Nice deep breaths.
That's it, mate. I'd love to guarantee Jake that everything's going to be okay, but at this stage I can't promise anything. I'll get you inside.
1918.
Yeah.
That's your year of birth? Wow.
Yeah.
Chris and Sam are en route with 104-year-old Nelly, soon to be 105.
How's your pain at the moment?
It's all right.
A nasty fall left Nelly with a major cut that needs urgent attention to prevent a potentially deadly infection.
Now, Nelly, you probably get asked this all the time, but what's the secret to getting to nearly 105? Is it brandy? Is brandy the secret? Glass of brandy every night?
No, I have Baileys.
Baileys. Oh.
Baileys, there we go. Sam, we're going to have to get on the Baileys.
Nelly is an absolute legend. Not only is she the toughest 104-year-old I've ever met, she's given me some tips on long life. In this case, for Nelly, it's a nip of Baileys every night. Finally, a routine I can get behind.
I like it.
Now, Nelly, I can see a ring on your finger there. Tell me about your husband.
Oh, he's been dead a few years.
Okay.
He was 94 when he died.
94, wow. Where did you meet?
Dancing, I think.
Dancing? You met him at a dance, hey?
Sam, we've got to go to dances.
Do ballroom dancing.
Oh, nice.
I wish that you could just go down to a local dance and meet your wife now. I feel like things have changed so much from those days. If you don't chat to someone soon enough, they've moved on to the next person. And honestly, I just don't think there's that true connection or commitment that there used to be back in the good old days.
All right, Nelly, I'm just going to duck inside and have a chat to the hospital staff. Chris is going to sit in the back with you, and you can talk to him about how he might be able to meet a girl. He needs some help.
You're a tough cookie. You've done a fair number on your face there and you got yourself to the doctor. That's incredible. You know you can always call us, though. We could have come and helped you up off the ground.
Oh, there was blood everywhere.
To be 104 and walking around with a walker is incredible. I wouldn't have guessed you were 104.
Yeah.
Diddy, going in.
Hopefully for Nelly, she hasn't broken any bones. But if she has, that can be significantly debilitating. As we get older, our ability to compensate becomes less, and often patients of her age won't bounce back.
It's now up to the doctors to do everything they can to get this incredible centenarian back home for her 105th birthday party.
Are you comfortable at the moment, though? You look quite comfortable.
They don't make them like they used to. 104, fell, smacked her head.
Yeah.
And just went,
straight up, get some with her day.
I'll get my son, who is 80, to help me up and I'll just go see the GP. She'll be all right. Far out. Who knew? Bailey's was the secret to a long life.
Yep. After work, we'll swing by the bottle and get some Baileys.
I tell you what, if I could look that good at 104, I'll bathe in Baileys.
Hi, Jake. So what's happened?
Oh,
yeah, I see that.
Schoolboy Jake badly injured his arm falling from a basketball hoop.
There you go. Nice. Breathe it out, breathe it.
Carlos and Nee were worried the 13-year-old could have permanent nerve damage in his arm, putting his baseball dreams in jeopardy.
Do you think I can play baseball again? So I want to go to Major League.
At hospital, doctors confirmed Jake had suffered a nasty break.
How's your arm feeling now?
Better.
Ready for a throw?
Yep.
6 weeks later, Jake finally has the cast off. With the help of his dad, he's trying out his pitching arm for the first time since the accident.
I hated every bit about having the cast on for 6 weeks. I had no movement, I could barely do anything. I was worried I couldn't play baseball again.
That's a nice shot.
Happily, there's been no long-term damage, and the 13-year-old's dream of playing Major League Baseball is still alive.
Your throws are getting stronger.
I'm happy to be back and playing baseball. I'm excited to start my pre-season.
Nice throw.
Thanks.
All right, so we are going to a 104-year-old. 104?
Chris and Sam got a shock when they were called out to their oldest ever patient.
Hello, this must be Nelly. How are you feeling at the moment? Pretty sore. Yeah, I can imagine. Yeah.
A bad fall at home left 104-year-old Nelly with a deep cut to her face.
Ooh, you can see a bone.
Putting her at high risk of a deadly infection. Nelly's son and carer Robert feared his much-loved mum may not recover from the accident. Remarkably, after 4 days in hospital and 10 days in rehab, Nelly made it home in time to celebrate her 105th birthday. As for Nelly's recipe for a long life...
Is it brandy?
No, I have Baileys.
Baileys? Sam, we're going to have to get on the Baileys.
The boys have taken her advice to heart.
I'm staying calm, but my chest.
You are doing so well, okay?
55-year-old Lena called for help when she suffered crushing chest pain.
All you need to do is just breathe. Your heart rate's just a little bit faster, okay?
Oh.
Hey, Laura, can you just go on a 2, please?
Aaron tried to keep his patient calm.
I promise you I'll look after you, all right?
But it was a terrifying trip as Lena's weak heart began to fail.
You're okay, I've got you.
At hospital, Lena's heart was tested.
Big breath in. And out. Good.
Sadly, doctors have advised that Lena will almost certainly need a heart transplant to survive.
Did they tell you that chest pain could be a heart attack and you can die?
If I run, I might blow it off.
Retired party bus driver Brian refused to go to hospital despite having chest pain and a worrying headache.
He's going for a run. But I think injecting something into him just to take him to hospital is a fair stretch.
After a tense negotiation, Dan ultimately prevailed.
I feel okay, but am I okay?
At hospital, doctors discovered this Adelaide celebrity had suffered a stroke. Luckily, after 4 days of treatment, Brian was allowed back home.
Yeah, good kill.
And he's now enjoying the company of his family and pets.
Oh, he's hungry.
My whole life, time I've known him is drove buses. Every day he would wake up, go out there, fix the bus up, get it ready for a tour. It's been his life and pretty much my life too for the last nearly 40 years.
Unfortunately, Brian's stroke has affected